solar and receive an average of $20,000 to do it. Now the best part is you can keep that
less likely to be eradicated. So
likely. Do you think that's possible? Let's hear what Dr. John Campbell says. And the CDC get vaccinated is actually more likely. Do you think that's possible? Let's hear what Dr. John Campbell says. And the CDC actually vaccinated, you're more likely to get infected with COVID. Do you think it's possible that if you're vaccinated, you're more likely to get infected with COVID? Do you think that's possible that if you get vaccinated, it's actually more likely? Do you think that's possible? Let's hear what Dr. John Campbell says. And the CDC actually says.
Why is Jimmy Dore listening to this idiot who's well known for spreading misinformation about COVID? He's found his just typical social media savage. He's found a way to make money on YouTube going against the mainstream, right? COVID is not really that big of a deal. They're trying to fearmonger and all this kind of stuff. And this is the truth they don't want you to know. Why is Jimmy Dore, why is this the guy he's getting his information from?
Today's talk, it's Tuesday the 29th of August. We'll be hearing from the President of the United States in a minute about his thinking of everyone in the United States. It looks like he wants to get a new vaccine, additional COVID vaccine in autumn. But we'll get it from his own mouth in a minute. And also I've been getting lots of questions on the new variant that seems to be emerging. And the CDC have said that people who could get this variant are actually more likely to get it if they've been vaccinated. So we're in a situation now where vaccination, according to the CDC, is increasing the likelihood of infection.
Being vaccinated increases the likelihood of infection. Now, if that were true, that would be pretty insane, especially in the context of what Jimmy Dore has been preaching for so long. But is it true?
Incredible. If you don't think those two things add up very well, then stick with it. Let's look at what's going on here first of all. This is the risk assessment summary about the new variant from the Centers for Disease Control. Now, the new variant under consideration is called BA2.
Okay, so this is a good thing. He's looking in the CDC website. So even if you don't trust Jimmy Dore, and you shouldn't, and you don't trust Dr. Campbell, and you definitely shouldn't, this is not them. This is the CDC, right? CDC is saying this. So it's legit, right? Well, let's see.
BA.2.86. Now, the fact it's a BA tells us it's an Omicron derivative. So this is not something completely new. It's not a new virus. It's an Omicron derivative. It has evolved from the Omicron variants.
And so what the Omicron does is give you very mild symptoms.
Wow. So Jimmy Dore is still spreading this misinformation about mild symptoms. Lying with the truth. If I remember correctly, he's absolutely accurate in saying that it had mild symptoms. But what Jimmy Dore is fundamentally missing is that in order for a virus to be really dangerous to us, it needs to have the right combination of infectiousness and lethality. If a virus is very lethal, has a high death rate, many people who get it will die, right? Then it doesn't have to be that infectious for it to be a problem, right? Because just to give you an example, let's say something had 100% death rate, right? Everybody who gets this will die. Then it doesn't need to be all that infectious to be a big deal because, millions of people got COVID, right? If you had just 10,000 people get infected with this disease, that's 10,000 deaths because everyone who gets it will die, right? If you have something that's not very lethal, something that has mild symptoms, then unless it is highly infectious, it's not a big deal, right? You don't have to worry about it because most people will be okay. However, if a virus has mild symptoms and is infectious enough, then it can actually be devastating. Case in point, the common cold, which is what idiots like Jimmy Dore and Kim Iverson like to talk about, how it was mild symptoms and it's kind of like just a cold. If you were to infect every single human being with the cold right now, it would be absolutely devastating. Just the cold, the normal cold itself, which we don't really worry about. If the infection rate goes out of control to where every human being on this planet has the cold, that would be a massive crisis because the amount of people that would die would be massive, right? If only 1% of the people die from a cold and you give 8 billion people a cold, what is 1% of 8 billion? 1% of 8 billion is 80 million. So 80 million people would die from the cold if the cold had a death rate of 1%. So we did the math here. So the flu, not the cold, because the cold actually has a very low rate. The flu has something more that we could work with. So 0.1% mortality rate. So if everyone had the flu, which is just the flu, right? People want to downplay, Omicron. They say it's just the flu, right? Well, the flu kills 0.1%. And if everyone had the flu, 7.8 million people would die. 7.8 million people would die if everyone had the flu. So the point is, if you can infect enough people with a halfway decent virus, like even the flu, then you can kill a ton of people, right? How destructive a virus is, again, is a combination of the balance between how deadly it is versus how infectious it is. The more infectious it is, the less deadly it needs to be. The more deadly it is, the less infectious it needs to be to get a similar impact, right? So you can't just look at a virus and say that it's not that serious while ignoring the infectious rate of it, right? Because if enough people, it's not just people are going to die just simply because of the numbers as well. We didn't even talk about overwhelming the healthcare system. If every single person on this planet had the flu, all of our hospitals would be absolutely overrun, right? Because a percentage of those people are going to need to be hospitalized, and we're just not going to have enough facilities for it, right? So even something that is not that deadly, if it's infectious enough, it can be a really, really big problem. And because Jimmy Dore is a savage who doesn't care about the lives of his viewers, he doesn't care if they die, he doesn't care about the country, all he cares about is himself and his profits. He doesn't care to research these things and to understand these things. All he does is he looks for things that confirms the narrative that he's been promoting. The Rona is not that big of a deal. It's the vaccine that we need to worry about. Like anything like that, that's the most profitable. He's gonna jump on any story. So he saw this from Campbell talking about, people who are vaccinated are more likely, whatever. Oh, that's great. Let me put that out. That's gonna get me a lot of views. That's all he cares about, right? Let's listen to the rest of what he has to say.
Virus, and it's very unlikely that it's going to make people sicker. In fact, all the evidence so far shows that it's not. It's not making people iller. And personally, I'm not worried about this. It's just to be expected that it's going to be viral evolution. Let's carry on and look at it. So it's been detected in Denmark, Israel, 2 cases in the United States, case in the United Kingdom.
So this is the part right from the CDC. This is it.
It's maybe more capable of causing infection in people who have previously had COVID-19 or who have received COVID-19 vaccinations. Now, the way they've worded that, I do hope it's not disingenuous, because we know that the mutations on this new variant are virtually all on the spike protein. And we know that the vaccine is specific to spike protein, so it's not surprising that the vaccine is causing trouble. We'll be looking at a minute in why it's actually probably causing more likelihood of infection. If you've got natural immunity, you've got antibodies and resistance to membrane protein, envelope protein, nucleocapsid protein, genome protein. It's polyclonal. So I really find that statement a little hard to understand from the Centre for Disease Control. Certainly see our previous vaccination would have an adverse effect, less so the way that natural infection would have an effect. Although, to be fair, natural infection, of course, will cause some antibody production to spike protein, and that's a small component of the immune system.
Now, Dr. Campbell has a really big following. He's making a ton of money doing these videos. So he has the power to get all the information he needs. He didn't have to just read this and come to his own conclusions, right? He could have contacted the CDC, and I'm pretty sure they would have talked to him and explained what they wrote to him. But he chose not to do that. He chose to just look at this, come to this conclusion, and then put out a video, Jimmy Dore doing the same exact thing. Neither cares about the accuracy of what they're putting out. They don't care if what they're saying could actually lead to the death of people watching it. Doesn't matter to them. All this is content and money. Savages, both of them.
Why is this? Is not talked about. Is it because that repeated vaccination has caused stimulation of the T suppressor, now called T regulatory cells, that down-regulates the immune response? Is that what is happening, this opposite effect of vaccination? Or is it that
He's just asking questions. Let me show you what it looks like for someone who actually cares about the truth and is not just on YouTube trying to make money, putting out whatever they think they're going to get the most clicks from. So if you actually care about the truth and you read this, you would find it to be shocking. Perhaps. Depends on how you read it, right? Your interpretation of what these words mean. But if you interpret it the way that Jimmy Dore and Dr. Campbell are, then you're going to be a little bit shocked, and you're going to be kind of like, whoa, that's kind of crazy. And they're actually putting this out here? Am I missing something? Right? So rather than just go with your instincts, you would want to know more, want to learn more. And to learn more, you're not going to listen to a buffoon like Jimmy Dore or Dr. Campbell. And I know some people are going to get offended by me calling him a buffoon. Dr. Campbell's obviously, in my view, pretty smart and definitely very knowledgeable. However, his character seems to be similar to that of Jimmy Dore, which is to say he doesn't have much. So not exactly someone I'd want to listen to, even though he should be a good source. He has the know-how. He could be a good source of knowledge if he chose to, but he wouldn't be making as much money, right? It's not as much profitable for him to be going along with any kind of mainstream narrative, right? The money is in going in opposition to the mainstream narrative, whether that is correct or not, right? Because sometimes the mainstream narrative is incorrect, right? But the money comes from always basically going against the narrative. But anyway, for someone who actually cares, you would want to investigate, and you're not going to want to use these biased people. So I'm just going to do a search for maybe more capable of causing infection. Infection in vaccinated. So you can see we confirmed the source that this did come from the CDC. So what he's reading, because I wasn't sure if that was, I think it is his notes, but I think he took it from here, copy and pasted. So this legitimately, they did say those words, but what do those words mean? Maybe more capable of causing infection in people who have been previously had COVID or received the vaccine. Of course, Jimmy's not going to focus on this is saying that natural immunity isn't helping you either. Let's just focus on the vaccine not helping you, perhaps. So right away, by me just searching for that, the third article comes up, right? So Jimmy Dore is a grown man, and he knows he's talking about medical topics. And when you're talking about medical topics, you're talking about potential life and death situations. You definitely don't want to misinform people. If Jimmy Dore wasn't a savage and actually realized the large audience that he has and potential impact he could have on people's lives in terms of causing them harm or helping them, he would have done at least some level of research into this, not just put on some other dude's video and just trust what he says, right? A guy who we know is incentivized to put out this kind of narrative. And if he did any kind of search at all, it's not a whole long, 10 minutes, 15 minutes, half an hour, just seconds. I typed in that phrase and the third link, the CDC didn't say vaccinated people are more at risk. Okay, so just because I see this in AP News doesn't mean, okay, debunked. I want to hear what they're saying. So what is this actually saying? Let me look at it and see if it makes sense. In the risk assessment summary published August 23rd, the CDC wrote that the BA 2.86 variant may be more likely to infect people with existing immunity to C19, either from vaccinations or prior infections, than previous variants. It did not say that vaccinated people are at higher risk than the unvaccinated. So we're going to go to the source and see what it says. May be more capable of causing infection in people who have previously had COVID-19 or who have received COVID-19 vaccines. Scientists are evaluating the effectiveness of the forthcoming updated vaccine. Notice that the CDC themselves is confirming that this is not going to cause more severe illness. So what the AP is saying, and I need a little bit more confirmation, because Because unlike Jimmy Dore, I don't do the confirmation bias thing. I'm not just going to look for an article that goes against what Jimmy Dore says and just accept it. Unlike Jimmy Dore, I'm not going to just accept something that goes along with a certain narrative, right? I need to understand what's being said here. I need to make my own assessment of the accuracy of the information, and then I go from there because I actually care about the truth, unlike Jimmy Dore and Dr. Campbell. And both of these people, I'm sure, could easily contact someone at CDC to ask these questions, right? Even if you believe the CDC is up to no good, blah, 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 he can still call them and have them tell him nonsense, and then he can tell you about what nonsense they told him, right? But he's not going to do that. He's not going to call CDC. He's not going to do the same research I'm doing. He's just going to go out there and spit out more, type of content that he knows he's going to get money from. And I'm sure Kim Iverson has done a video about this already. If she hasn't, she's about to, right? Savages. That's all they do. So what the AP is saying is that they're saying that, essentially, to paraphrase, this variant is more effective at infecting people who are vaccinated than the last time. So meaning the vaccine is less effective with this variant. Now the way that Jimmy twisted it is they're saying that because you have the vaccine, you're more likely to get infected. And again, I think it's a little inconvenient that they also say if you're previously infected as well, right? So natural immunity is also compromised by this variant. The agency has not said that those who have been vaccinated against C19 are more likely than unvaccinated. So that's true. They did not make a comparison to unvaccinated. They're specifically talking about people who were vaccinated and previously infected. It's only Campbell and Jimmy Dore who made an assumption that unvaccinated people would be better off. But the article did not reference a comparison between unvaccinated and vaccinated. And I think if they did, that would be unfortunate for Jimmy Dore and Mr. Campbell in terms of an ability to create a video that's going to make them some good money, which is the point. So rather it said those who've been vaccinated or previously infected may be more susceptible than they were with prior variants. So the comparison was this ability to infect you with this variant versus the previous variant for people who were vaccinated or previously infected. So in other words, and again, they're just saying that the vaccine was more effective with the last variant, not so much with this one. I would assume the unvaccinated people still are the ones who have the worst outcomes. But that was not discussed in this article. It is Jimmy Dore and Dr. Campbell who added that element to the story erroneously. So they reference the elaboration here about the large number of mutations. Let's take that from the source rather than here to avoid any errors. So here's the immune impact section directly from the CDC website. The large number of mutations in this variant raises concerns of greater escape from existing immunity from vaccines and previous infections compared with other recent variants. So this is what I was looking for. I'm not going to just go with what AP says. Unlike Jimmy Dore and Mr. Campbell, and I'm sure Kim Iverson, I'm not going to just go with something. I want to make a video debunking Jimmy Dore, and this says he was wrong, and that's it. No, the AP could be wrong, right? Jimmy Dore could have interpreted it correctly, and AP could be wrong, right? So I need to validate what the AP is saying. So they added the additional context, which is what I was looking for. But again, I didn't trust their quoting of it. I went to the source. And in the source, it's confirming what their assessment is, which is, again, that this seems to be better at getting past protection from previous infection or vaccines. So it's not saying that because you're vaccinated, you're more likely to get it, but rather your vaccine is less effective. So as proof of what I'm saying about Jimmy Dore and Dr. Campbell, I'm pretty sure the CDC is aware of this misinformation that's spreading around, and they're going to add additional details to clarify this, especially and eventually data concerning the outcomes of unvaccinated versus vaccinated or previously infected. And if that data shows that the unvaccinated has the worst outcomes, you can Jimmy Dore and Dr. Campbell to not cover that. Just like Kim Iverson, right? She made, when Omicron came out, she made all this like, oh, it's just a cold, it's a cold. And then when we saw the high number of deaths just based on the fact that it was so infectious and, you know, what it was doing to the hospitals, she just conveniently didn't report on it, right? These people just keep you in these little bubbles which profit them the most. So stay tuned. We're going to probably get more information about this and watch Jimmy Dore not report on it because he doesn't care about the truth. He is a internet savage. Only cares about himself. All right, I was trying to see if I could find some more details, maybe get some feedback from CDC on this, but didn't really find anything. But you ask yourself why it is that neither Dr. Campbell nor Jimmy Dore bothered to investigate this before reporting it out to millions of people. Is it because I'm correct and they're just savages? Or are they just dumb? Comment below.